Welcome to the podcast where we discuss all about Bethlehem and its future. I'm your host, Ryan Conrad. We're diving into the stories, ideas, and people that make our community shine. So let's talk Bethlehem. Hello, everybody, and welcome back to Let's Talk Bethlehem. I am so excited today to have Dr. Mark and Dr. Jill DeVries practice directly across from the post office.
Correct.
And we have a really interesting story to tell our audience today about your practice. But the first thing I'd love to ask is just to introduce yourself, tell us a little bit about yourself and your journey and your family.
Sure. So I wrote a little timeline here so I
Sure.
don't miss any important details, kind of our little journey to Bethlehem.
Awesome.
So,
love to hear it.
Yeah, we came to Alexander County first in 1999. So we've been here 26 years already, and we were just brand new young family physicians at the time. Had only been practicing for a couple years.
Okay.
But Catawba recruited us to the area.
Okay.
And Dr. Steve Merrill was his practice was growing in the spot that's now the urgent care of Mountain View in Taylorsville. So we joined him in that little office and quickly outgrew that space. We couldn't grow our practice like we needed to. So Catawba actually transferred us down to Northeast Family Practice on Springs Road for 3 years. So we were there for 3 years, still living in Alexander County. We were in the Wittenberg community at that point. And I don't know, Hickory just didn't feel like a good fit for us. We kind of felt at home in Alexander County.
Yeah.
So when it's time just to say, this is not a good fit, we need to leave that practice, we decided to come back to Alexander County and join Family Care Center. So we came there in 2005, I think
2005,
it was.
right.
Yeah.
Okay.
And, over the next 10, 12 years, practice was good, growing, great people to work with, but kind of the medical system was changing during those years.
What were those years where they were changing?
I guess the 2005 to 2015, thereabouts. The insurance companies were getting a lot more heavy-handed, I guess.
And kind of at the same time, maybe God puts things in there for you, but we were learning about a different way of doing things from the professional doctor perspective, and that's where the direct primary care started kind of maybe growing as far as our interest, probably.
That movement, I think, had started around 2000, 2005. And, as physicians, we're always going every year to medical conferences to keep up our skills, learn about new medications, new procedures, new styles of practice. And, around 2015, 2016, started hearing about this thing called direct primary care.
Primary care.
Yeah, DPC for
I'm
short.
so excited to talk about this with everybody because I knew that there was some, my chiropractor doesn't deal with insurance, and I love that. And I can just go in, get my back cracked, and be out of there, and no claims, no, this is not a bill, things that come in the mail, it shows you how much it covers and all this stuff. And I'll just say this, and we can talk about this more in my list here, but I don't think that anyone really likes insurance. I mean, it might make you feel safer and protected, like for automobile, but health insurance is in my opinion, a disaster. I don't think anyone ever has said the United States have great health care. I mean, and not health care, but great health care insurance, right?
Right. It's costing more and more and covering less and less.
Yes.
So,
I will say, no one's the bad guy. There's a lot of reasons for the cost of everything going up.
Sure.
But at least the direct primary care model is attempting to kind of find ways to kind of give alternatives, and that's the good thing for it. And that's why it appeals to, I think, patients and to providers like doctors, nurse practitioners, physician assistants, as something they may want to start because it's set up differently.
Yeah, for sure.
So taking off some of the pressure of productivity, that's what we were finding. We had to see more and more patients, had less and less time with the patients, and we were sort of losing the heart of what medical practice, medical care was.
Right.
And so we actually thought about opening a Chick-fil-A in Bethlehem if we
Yeah,
could have swung that.
I think that would do pretty well, probably.
But we weren't qualified and didn't have the capital to invest in that kind of thing.
Yeah.
So, these conferences started hearing about direct primary care, and we thought, you know what? That might be something to consider. So, it just intrigued us.
Yeah, it really fascinating. I love this story. As a couple working together in healthcare, like what's been the most rewarding and challenging part of your journey? What would you say?
Oh, I would dare say both of us feel like we couldn't have made that leap from the insurance-based practice to direct primary care alone.
Yeah.
We kind of needed, to bounce
Right.
ideas off of each other and, plan it together. So,
And I would say there's a lot of colleagues or other people that we know of that almost like are mentors that kind of help tell you what you need to do to kind of even think about or start this. Jill took some small business classes from CVCC, which were excellent to kind of help along the way. So, there are a lot of good people out there. Maybe God provides at the right time to kind of guide you on your way. So that's been, I think, a blessing for us, kind of stuff.
So once we kind of got over that hurdle of this is overwhelming to think about, this is intimidating to think about, running our own practice, being doctors, but also being business people. I don't think by nature either of us is terribly entrepreneurial. And clearly required that.
And in addition, it's sort of a new navigative, that's not a word, a new space to navigate into, or fairly new concept of like the NPC model, right? So, how long has this been? Not aside from you guys, I know there's probably other practices around.
Yeah, it's been a grassroots movement, absolutely. Just starting small and kind of growing organically.
And it's kind of originated all over the United States. People experimenting how to make a new model work. So they're pioneers in the development of the direct primary care model.
It's been a very encouraging community, other DPC docs, and that mentorship, like Mark had mentioned, has been very helpful to us going and visiting other DPC practices just to kind of see how they're run. Now, still, there's a little saying within DPC that if you've seen one DPC practice, you've seen one DPC practice, because they're each as individual as the docs who own them and practice there and the communities they serve.
Yeah.
So, we've just sort of created Bethlehem Direct Care to fit our needs with our family and the type of practice we like, and the needs of the community.
Very cool.
Bethlehem.
So I know we jumped right into it, but I want to maybe if you could explain to the audience exactly how the DPC, which is direct primary care, how that model sort of works, and if someone was, I'm assuming you're taking new patients, like what they would need to do to be prepared, like how do they get become a patient at your practice?
Well,
and maybe just a little bit of like how it works. I mean, we don't have to run. We'd probably be here for 3 hours if you had to explain it all in detail. But
well, the main thing, the direct primary care model is for certain people. It probably is the best thing, but the traditional models out there, not one's better than the other. It's really what fits your needs. So the way we do it, and there are other direct primary care clinics. But we offer just a 30-minute, we call it meet and greet appointment. So there's no pressure, no commitment, anything else.
No payment, no obligation.
Yeah, you're just coming in.
Just have people who are interested in the practice come in and see what we do, talk about it, see our facility, meet our personalities, see if it's a good fit for what their medical needs are.
I love that. Just sort of a little, like you said, a meet and greet. That's what's a great idea. Yeah,
and some people... have to make decisions with a spouse or family, or got to figure out, they're healthy. A lot of people, thank goodness, are healthy, and they may have insurance, and they may have, some insurances offer, a low copayment and other stuff. And is that the right thing to do? We can't answer that question, but we can tell them we're very transparent about cost and other things that we do, and kind of our experiences and kind of how we approach things. And, it's nice that they can kind of see everything, and then they can make a decision, pray about it, speak to others if they have to.
Sure.
And if they're interested, they can come in and make a new patient appointment.
Very cool. I love that. So let's jump to this one. What feedback have you received from patients about DPC model compared to like traditional insurance-based care?
Yeah.
So.
Yeah, certainly patients seem to like it as much as we as physicians do, to kind of get back to that basics of we have time to spend with our patients. We can talk with them, educate them. Patients feel heard. We hear that a lot, that, I finally feel like my issues have been heard.
You're not herded in and herded out.
Exactly, yeah. They have time to tell us what's going on. And again, I think we're both very transparent about, we're not, miracle workers. Just because we have time to spend with you doesn't mean we necessarily are that much smarter or can figure everything out. If you've been to 10 doctors and they can't figure it out, I'll listen to you, I'll do my best. But yeah, we're not miracle workers, but still that opportunity to talk with patients and let them tell their story. This is what I'm dealing with. And give them our best guidance. Education, I think, is key for both of us to educate our patients.
Yeah, I kind of mentioned to people that I think we're the same people we were at the prior practice before starting this one. It's just that the model is different, and that helps, I think, as far as that's what you're looking for. But, they're good people in the medical field all over. There's not I don't think a difference between the practices, just the model that's different. Yeah. And that's what you got to figure out if that works for you, kind of stuff.
Yeah, people like the price transparency. As you said, there aren't surprise bills from our office.
Yes.
So, and they know what they're going to pay. It's that monthly membership fee. We didn't really talk about that, or at least yet. That's how our billing works. It's just, for adults, we charge $60 a month. For kids 20 and under, $30 a month. And we have a family cap of $180 a month, which is the equivalent of 2 adults and 2 kids.
Yeah. I think my kid was sick like 3 times in a month. And that, even with insurance, that's like 120 or 150, and he's covered for my insurance. So, we don't charge per visit. It's just that monthly membership fee to have access to us. And then, patients utilize that access as they have need. Yeah. What about like if doing lab work and stuff, like sending off to like LabCorp, or how does that work?
There's several national laboratories, but we do use LabCorp like a lot of the practices in the area. And they've been great because, again, these pioneers in the models direct primary care, they've approached LabCorp, and LabCorp's met with several of these different clinics, and they kind of know that although there might be a wide variety of patients within the practice, a lot that do or do not have insurance, and insurance can cover some things, but to get all that out of the way, for LabCorp, if they get paid for their the cost of their test, they will pass on a savings, to the practice or individual. So they've done a wonderful job even helping us set up personally, but they will give us a discount, and we can pass that along to our patients, because the majority of our patients that join the practice may not have any insurance kind of reimbursement at all, and we don't use that at all. So
right, even if they have insurance, I say we're not going to bill it from our practice. We don't get any payment from insurance.
Yeah, you get a separate bill from.
But your insurance will still work outside our walls like it ever has. So if you want to use it at the pharmacy for your prescriptions, you can. If you need to see the cardiologist, they can bill it and it'll cover for that. God forbid you need your gallbladder out or something, it'll cover at the hospital.
Yeah.
But we don't bill it. We don't get any payment from insurance. It's just payments directly from our patients. And we care directly for our patients without the middlemen. So the direct in our name, it stands for a couple different things.
Yeah, that's really cool. I was going to ask, like, insured based, like your traditional like practices. Did they get did they get any discounts or anything like that from LabCorp?
LabCorp may offer or work with the individual if let's say they don't have insurance to mark down the price. If you give payment at the time of service and not go through insurance, there's always a discount because there's less denials and all these other
I
things.
love that they
occur.
like kind of reward you for not having to go through that and deal with that
Exactly.
in so many words,
Yeah.
Well, there are a lot of businesses will give a discount if you can pay, like, I don't know, like an automobile at the time. They'll, they don't have to,
Cash discount. Yeah.
Yeah. I have a really interesting story. I'm trying to find the right time to tell it through this because I want it to sort of relate to what we're talking about at the right time. But don't let me forget to tell you at some point about my wife and her epidural. I think it's a really interesting story, and I'd love to share it with y'all and the audience. So at some point, don't let me forget to not tell it.
Yeah.
For community impact, let's talk about so with Bethlehem Direct Care emphasizes personalized care. How do you think that approach has impacted the local community? I know a lot of people have said this feels like I'm being heard, and on a personal level, do you think it's had a pretty positive impact on Bethlehem?
I think, like Mark had mentioned earlier, it's just good that people have options. They have choices about how to receive their medical care. So, we feel honored to be able to provide an alternative to the hospital-owned practices. So I think, our community is just it's a great site for it. And we've got a couple of Bethlehem stories that we can share about that, too,
I'd
before
love
our
that.
time is through. But, I think it's nice, too, our patients who are from this area, we'll see them at the pharmacy when we're there ourselves picking up something or at Lowe's Foods or somewhere. So it's really kind of neat. They get to see us living in the community as well as working in the community. But I think we do draw patients from a pretty wide array since there aren't a lot of DPC practices in this area yet. So
to be honest, I got to be completely honest. I didn't even know what it was. I hadn't heard of it. Didn't know this thing exists until I talked to my neighbor, and he was like, "You've got to bring these folks on. They're amazing. It's incredible what they're doing." And I was like, "Say no more. Let me call them. Let's get them on." So
that's very kind of that individual, and I got to say that it really helps us that. A lot of times we have a website like a lot of places do, so people can, research and look us up and stuff and kind of learn a little bit. But most of us, I'd just say, luckily we haven't had to do a lot of advertising. Not to say it's not necessary for businesses, but a lot of the advantages for us is that we've not had to put a lot of cost into advertising. It's been more word of mouth. That's a blessing because that keeps our costs down. We hope to keep our costs down to be reasonable for our patients.
Absolutely. And it's such a new and unique concept. I'm just going to call it, it's practice. And that I think organically people are just going to talk about this because it's different. It's not your traditional healthcare. So,
And we try to keep, kind of just small, low key at our office. It's just the two of us, and we call her our patient care coordinator, and that's Whitney Reese. She's been with us from day one. So, it's got that small family feel just within our practice. So again, that fits well with kind of the hometown community feel of Bethlehem too. So
what's interesting is that occasionally people will say, I was asked, somebody comes to a meet and greet how they heard about us because, we want to make sure, and a lot of times it's word of mouth, or even occasionally Taylorsville Times, and they have the Bethlehem Star, been kind enough to, put a little thing in there, and they say, I remember reading about that in a little article. And then when the time was appropriate that they may, think about their health care, they, look us up and kind of come in and just see if that's the right thing for them, kind of stuff. So that's been nice too. Taylorsville Times has been wonderful. And Bethlehem Star.
Yes, definitely. And one of my little Bethlehem stories is, how we actually ended up having the space that we have in Bethlehem. Because we were living in Bethlehem by that time. I think it was 2007 or so that we moved from Wittenberg community over to Bethlehem community. And again, that was the time we were starting to think that, we're hearing about this direct primary care. Maybe we ought to do that somewhere in Alexander County. And around that time, too, I think, Wayne Wilson's practice had closed. So, Dr. Wilson left kind of a gap. I think he was a good physician. He did some not so savory things as far as money behind the scenes. But,
Right.
But it left a gap in primary care, family medicine in Bethlehem. At that point, we were family docs living in Bethlehem, but commuting 20 minutes up, into town to family care center. So we're like, well, let's start looking for office space. And still kind of keeping things under our hat as far as what we were thinking about doing. But we thought, we can't do it if we don't have a place for it. So, let's start looking around.
Location.
It's and just to be clear, I know I mentioned this right off the bat and sort of probably blabbed it out really quickly, but their practice is located. If you cross and go past Shaggy's on your right and come up to the intersection, Dunkin' Donuts is on your right. Cross 127 and go up the hill. On the right, you'll see the post office.
And the Bethlehem Branch Library.
And the Bethlehem Branch Library. My son loves to go there, and he loves to read, and he goes in there all the time. We take him there.
Yeah, right.
But directly across the street, that's where their practice is located. I know I mentioned it once, but I wanted to say it one more time to make sure people knew where you were located.
Yeah, and that's kind of where I'm going with my Bethlehem story here, too. So you remember they used to, I guess just before COVID, we used to have Bethlehem Days. That whole celebration of Bethlehem Day, I think it was just a one-day little festival event. And it was at different locations through the county. But, around the time we were looking for office space, it happened to be at just that intersection by us.
I remember that
Shiloh Church over here and us in the library. So, Bethlehem Day was held there. So we were there, recreating with the kids, with the family. And happened to look over, and you were the one who spotted it. The building with the green awning, and Bud Kaywood already had his.
One of your
guests. I had Bud on 3 episodes ago.
So he had his self-storage in half of it, but the other half of this building had a for lease sign.
Yeah, and we just
Mark's
looked at the space. Kind of.
What do you think about that? Could that be a medical office? And we thought, well, it was just a big wide open space at that point. It didn't have walls in it much or anything. But I called the number on the sign, got in touch with Bud, and probably about a year in the making to say, I drew up I'm not an architect by any means either, but
floor plan.
A floor plan, thank you. Yeah, for just some exam rooms, a little front office area, office space for each of us.
Yeah.
So, that's the place that presented itself, and we thought, well, this is perfect.
Yeah.
Family docs living in Bethlehem. We'll have our practice in Bethlehem. So.
In a good location, and again, the history of that building, it goes back a long way. So when people first, started coming, I remember when this building was jet ski and powerboat place. And
at one point it was furniture.
Right.
Yeah.
Hardware store. Some people
store,
remember it being a hardware store
I don't
before
remember
our
that
time.
One.
Yeah.
I think there's a lot. The future looks really, really bright for Bethlehem, and I think your future looks very bright with your practice and business. And again, I can't say this enough. I love this concept and the MPC model, or I'm sorry, DPC model. Sorry. I love this concept. The minute I heard about it, I was like, I've got to get these folks on. I love this. I'm going to sort of switch gears a little bit and say, actually, before this, I'm going to give you a random question that's not on here. As you guys grow, and I anticipate you probably will, as you grow, what would you say is, would you ever reach a point where it's like, we can't handle any more folks? Would you think about bringing on another doctor at that point? Or would you say, hey, we want to just keep it small, these are our tight net, and then if someone decides to go somewhere else, we'll bring in somebody when it's available? Like, what have you thought about if you reach that point where where you would tip towards?
Yeah. So you want to start, or I'll lead, and then I'll let you finish it. I think we're on the same page about it.
We are.
We've thought about it, prayed about it a lot over the years, and I guess maybe 3 years ago, we did get to a point where we felt, okay, this is about as busy as the two of us can handle. What do we do? And at that point, we decided to do a waiting list. So people were still calling, asking about our practice, and we said, we're just kind of hitting pause right now as far as new patient enrollments, putting names on a waiting list, thinking about, do we want to bring on another doc and get bigger? Do we want to open a second location? What's the right thing to do? And this is not my phrase. I read this somewhere.
Oh, yeah.
It's, we want to be great, not big.
Sure.
So
Quality over quantity.
Right.
Yeah.
So I think, the Lord's just kind of leading us to say, let's just keep it simple. Let's keep it small. Let's keep it solid and sustainable for us, so we're there for our patients. But I don't think we'll bring anybody else on.
And by there's a practice in Hickory that opened shortly after ours, and they're still in business, Emerald Health. So it's nice that, and there's plenty of room for other of these type practices in the area. But some, our knowledge, some direct primary care clinics have had satellite offices, and actually I think that one does in Morganton or something. But we just want to keep it where we are. Yeah. And I would just say, as through the years, as healthcare changes, people may change employment, and for us, we just want people to use their resources as God gives them and use it wisely. And like some people will get insurance through an employer, and even though they like our care, the cost is there, so they may switch out for traditional primary care. And then we have people come in, likewise, when insurance gets too high, they can't afford, a model of that.
Yeah. So if it's offered through their employer, we sometimes have people say, I can't afford that every month. It just doesn't make sense.
So there's always inflow and outflow of every practice. And
I don't think a week goes by that we don't have somebody calling saying, hey, I'm interested in your practice. I heard about this. How do I get started? I'm like, well, we'll offer you a meet and greet. Come on in. And I've heard this used around DPC also, that it's kind of the Starbucks model. If a place does decide to grow, that you don't just necessarily bring on more docs and make it a big practice, because that loses some of that personal care.
That absolutely.
So they're like, instead of just expanding in one facility, or moving to a bigger facility, we'll just pop another DPC practice up over here or over here or over here, like Starbucks does. We experienced that in Bethlehem.
Nobody has 3-story Starbucks, is at least that, in maybe in New York, but
there's one in Viewmont, there's one in Bethlehem. They just pop up. So that's what DPC could do.
And that
even
makes
in our community.
That makes total sense. So let's talk a little bit about health and wellness. What would you say is the most common health issues you see in Bethlehem? The Bethlehem community, and how are you addressing them? What would you say?
Well, I think it's more nationwide, not just local to Bethlehem.
Sure.
But the common things that, if you refer to it like chronic disease, and that could be things that are common that put risk for cardiovascular and other type illnesses. But, blood pressure, hypertension, blood sugar problems, diabetes, elevated cholesterol, or
hyperlipidemia.
If you want to use that term. And then, a lot of us, injury, other stuff can have arthritis. We can have, a lot of different chronic type things. But
asthma, allergies,
those type things. So, for the Bethlehem community, I don't think there's any particular standout type condition, but they're all things that a lot of us have to deal with, especially as we go through life and go to the more adult.
Trying to say very delicately, as we get older.
That's right. I'm there. So
things start to fall apart.
That's right.
The older you get.
I would just say,
things change.
One thing that we're very blessed is we learn a lot about people, doing their best to learn about how the body works and maybe approaches to kind of stay in health or regain elements of their health. And we've got plenty of success stories, which hopefully we contribute to or they learn. And, a lot of people, once they have something good happen to them, they want to pay forward. And so you learn from that. And that's been very helpful, both for us and to maybe mention to no specifics, but at least to other patients. There could be other pathways that could really improve your health. we're very blessed to have medicines and all these other things and specialists because we're not specialists. We try to do all we can. But, yeah, there's a lot of approaches that people can take, and certainly we want to at least let them hear, what we know of that's available, to hopefully help them get to a better state of health.
Yeah.
Mm-hmm. I sometimes think of it, like our practice is sort of like a little co-op too. We're the BDC family. All of our patients, I consider them, part of our BDC family. But that co-op. That if this person tries this alternative type of treatment, has a great response, they'll tell us about it. They know that, again, as an independent office, independent thinkers, we're not going to, roll our eyes or say, oh, that's crazy, humbug.
Yeah.
It's like, oh, that's interesting. I may have to research on that.
Sure.
And then, if there's another patient with a similar situation, we can say, I heard about this from another patient. I vetted it. It's medically sound. Might want to give that a try.
Yeah.
And what works for one person doesn't always work for somebody else.
Not always.
Yeah.
And, some patients actually have a different approach we may not exactly agree with, and that's okay too. But, it's just trying to, be, what do you call it, a mutual decision making, how to approach things kind of stuff.
Yeah.
I think that works well, as far as the patients that we see. Yeah.
Yeah.
And I would say, too, that, since starting Bethlehem Direct Care, Mark has been able to explore more his interest in, like, functional medicine or lifestyle medicine. And
Right. But I always point out I'm not certified with
true.
anything, so I don't want to...
And we don't have it on our website to advertise that about our practice. But it's nice that, we have that open mind. And you, in particular, a little more training in some of these more lifestyle issues, how food is medicine, that kind of thing, or Mediterranean diet instead of medications for blood pressure or diabetes or such. So we talk with our patients about that kind of thing a fair bit.
And that was really like my next question, and you guys have pretty much been spot on and just jumped right into like, okay, here's the issues and what's the advice to address them. And I'm hearing they're open to modern medicine or alternatives, and obviously
I guess the proper term is integrative medicine.
Yeah.
Integrates it all.
Yeah. And then like obviously diet and exercise and eating what you put in your body, and try to be a little more mindful of those things too. Right. So very cool. Running a practice as both doctors and business owners, I know you guys have touched on this already a little bit, but how do you balance those roles of being business owners and
so I call
doctors?
It a practice because you're still practicing.
Still learning how to do all the business side of it. But like we had an attorney who helped us craft we call it a patient agreement. When a patient does enroll with us, it's not a contract. They're not on the line for a certain amount of time. There's not a penalty if they leave early or things like that. But, we did have to have a legal document about, these are the patient's responsibilities to us in our practice, and these are our responsibilities to the patients. So, we had an attorney help us craft those at the beginning, and we do have a very valuable accountant. He is just, worth every penny to help us with the business side of things. But other than that, it's just been more the mentors in DPC who have helped us to know how to do the business side, owning, being small business owners, plus being physicians. So,
and I'll just say, most doctors' offices do have some form of electronic health records, and actually to prescribe medicines you have to do electronically. But our particular electronic health care record or EHR, or what's the other term?
EMR sometimes, electronic medical record.
Right, either one. But you use software to do that, and ours particularly will give a shout out because they do have a lot of support for a lot of practices. Not all direct primary care practices use their software, but they're one of the main vendors. But it was Atlas MD, and it was
developed by DPC doctors
and his brothers that I think handled the IT part.
But specifically for direct primary care practices. So we don't have to do all these codes and all the crazy insurance stuff. It's just for documenting our patient visits and text messages, emails.
Yeah.
We didn't mention that much, but patients do have access to it. It's that way too.
Yeah, again, not
And then
coming
prescribing
from not coming from many doctors and providers have a lot of different skills, business and otherwise. But we mainly started off when we started practice employed, and so that was the norm. But going into a model where you're the business owner and trying to figure out how to pay and cover everything and get everything accomplished, I think the software that we use has been very helpful for us and makes the business side easier for people that may have been all employed, but they can get the knowledge to potentially jump into a direct primary care practice if they wanted to.
It does our record keeping. It does our billing. So, it's sort of an all-inclusive technology package, I guess, for Atlas MD. And, Mark is definitely our IT guy in the practice. So if the internet goes down or, phones are out or, things like that, he's our hardware, software kind of guy.
Okay, don't tell anybody.
Don't tell anybody. I think I just did.
It's embarrassing. No, luckily things nowadays are pretty straightforward, and just working at it, you gain some knowledge, and that's why at least the electronic records we use, the equipment we have, the other stuff is thankfully pretty straightforward, and a lot of good support people if we run into issues. So,
And for me too, Wednesday is a day I try to keep light in the office. We close at noon anyway, but on Wednesdays. But I try to keep my schedule light on Wednesdays so that can be more my administration day.
Yeah.
And, let's go around, see if I need to order any supplies, if we need gloves or hand wipes or sanitizing wipes or things like that. So kind of carving out that administrative time throughout the week.
Yeah. So you mentioned a little bit of like software and handling data and stuff like that. My audience may not even know this, but by day, I'm a UX, UI designer, and basically I'm a glorified graphic designer, but I cater mainly for software and applications.
Oh, wow. Okay.
And look at like how to improve the experience of working in the software and look at how they navigate through it, how easy it is to use it. And a lot of stuff, especially in the medical space, comes up about HIPAA compliance.
Right.
And that's a scary thing when you start talking about HIPAA and being practice owner and lawsuits and things like that. They can come up. And just to yesterday or maybe the day before, 23andMe. I don't know if you guys have heard about that on the news. They're telling everybody in North Carolina and South Carolina to delete all their data because they are selling and they're not sure what's going to happen with their personal information, and it's a mess.
Yeah.
But like having a third-party software to handle stuff like that for you is much better than like. And I assume that all of these have to be HIPAA compliant, right? But like just having software that you don't have to think about and deal with that'll handle that data for you is a good thing. So. And I think it's going to be more and more of a concern as we move forward of just privacy and where that data goes. And it's going to be a mess.
At least our group they're always innovating, and that's nice. There's always what's new kind of stuff.
Right. New updates on security practices and so forth.
Very cool. So where do you guys see yourselves in the next 5 years? Are you hoping to just be about right where you're at right now, just chugging along, or where do you guys see yourself in 5 years?
Well, the main thing is just hopefully to provide good service, to integrate other things that we can find that we can do to still keep our costs down, but to offer other services for our patients. And we discuss plans, but I would say that's the goal: is keeping costs down, still offering good care, and then even offering hopefully other services potentially if we can. There's always the financial aspect of it too, kind of stuff.
But just continue rocking
chugging
and
along.
rolling.
Yeah, very cool. This is sort of a broad question. If you could make one major change in the broader healthcare system, what would that be?
A change? I don't know exactly, but like one thing that comes to my mind is I would just like to see everyone in the United States have access to a family medicine doc. I think really putting that primary care at the front of everything could be a big help. So maybe I am answering your question more than I thought I was.
Oh, okay.
For everybody to have access to a family medicine doctor to, either prevent illness. Obviously, that's a main goal. Keep people healthy, get people healthy. Have that relationship for advice, guidance. It might not always need a prescription, but to have that go-to medical person, that's what I'd say should be front and foremost.
Yeah, and I think some things are already happening, but I would just say more transparent on costs. One nice thing that I think we can honestly say to our patients and anybody interested is that we're very transparent of how much things cost for what we do. And even outside, over the years, we've learned ways to kind of tell people what you're looking at, like for a diagnostic test like a MRI or something like that. We've got a pretty good idea, and luckily we have places around the community that can offer some services for people, especially if they're paying out of pocket like a lot of our patients would be doing, that they can just tell them one price. There's not, the bills coming later from several sources. And I think some of the even health centers give them credit that they participate in where they're trying to get patients and reduce their costs, and again where it's manageable for a patient that may need a certain service. Hopefully that'll continue going forward.
And I'm so glad you told that story told us about that, because that reminded me this is the perfect time to tell that epidural story.
Right. Yeah.
Okay, so our son, my wife, and I, Jack, he's 6 now. So 2019, we actually went into labor, and I just wanted to give people a little taste of I have good insurance. I was fully covered. And so we actually had to stay in the hospital for 3 days. Had some complications, it happens way more than you think, in childbirth. So she had a few complications. She had to stay for a couple of days. And right when it was about time to start pushing, or maybe right before, she was having some real bad pains. And the doctor said, we're at a point now where you can keep trying this, or it's going to be too late to have an epidural. There was a tipping point, and she's like, I want the epidural, because she didn't want it, but she just got to the point where she just had to have one.
Sure.
They don't call it labor for nothing.
Yeah.
It's hard work.
And, so I just want to give a little context. She was there for about 3 days. We had round-the-clock care, wonderful care. Nurses were in and out, coaching us through, getting us through this whole thing, So for the epidural, the anesthesiologist came in and put on some gloves, reached around, cleaned her back, sterilized, gave her the shot in her back, said, "You're good to go," and he walked out. So our total cost, and I'm fine to share this, was $8,000 after insurance, and $2,000 of it was for the 3-day care. The rest was for that one guy that came in with a needle and put it in her back.
10 minutes tops.
Yeah. So $6,000 for that guy to come in for 5 minutes. And
okay, I'm always going to play
not devil's advocate, but I always like to see the bright side.
And I'm not. They do what they have to do based on the costs and charges to recoup their services.
Sure.
But I would just say there can be complications of epidurals, and that's the real risk with that. So you have to have competency, other stuff, and the cost. You can't undo what they charge, but I would just say if there were to be a complication from that, I'm sure they would have addressed it within that. But if you had a beautiful son and she got through the labor,
Yeah. I would have paid $80,000.
That's right.
Yeah.
So
And I think that just kind of speaks, though, to specialty care sometimes just by nature of it.
It just costs
is
more.
expensive.
Yeah.
But that's, again, where we think kind of the beauty of direct primary care is. That primary care, family medicine, internal medicine, pediatrics, doesn't have to be expensive.
Yeah.
And yet the insurance companies sometimes make it that way. I'm sorry, I'm making them sound like the bad guy again. But, just taking primary care away from the insurance companies makes it so much more affordable for everybody.
Yeah.
It's just lovely.
I'm with you.
But I don't look as insurance as the bad guy. I think they have a role, and if
For
you
the
have
big stuff.
if you have that resource, that's wonderful. And I would just say is when you do procedures or other things that can have complications. Again, for legal reasons, other stuff, the cost is very high, so specialists really can't. There are some specialists do a direct primary care type thing and offer procedures and other stuff.
Direct specialty care, they call that one.
Right. But I just say for us, the hope is, and a lot of people that are interested in our practice, if they have catastrophic insurance, that is where you cover big expenses, like if you, God forbid, have to go in a hospital accident or injury or surgery, that it would cover those type things. But when you have a high deductible, the more non-urgent, kind of stuff that could be handled by primary care, and I'd say over your lifetime, I believe 80% of your health care can be handled in a primary care type office. That's hopefully what our role is, and with kind of reasonable costs, so to speak.
Very cool. Well, those are all the serious questions that I have. I have maybe a couple fun ones at the end if y'all are ready for those.
Sure.
Okay. What do you both enjoy most about living and working in Bethlehem?
It's convenient to about everything, so we love that.
Yeah.
We're close enough to the big city of Hickory, but we're not right in it.
Yeah.
It's got everything we need. We've loved the rec department for sports for our kids.
Yeah. Okay. So I didn't even share this, but you guys have 6 kids, correct?
We do.
Correct.
2. You said 2 were out of the roost.
3.
Well,
3. Okay.
3
Kind of,
of
yeah. I mean, the rundown is we've got one daughter who's 24, and she's a graduate of LR.
Very
living
cool.
and working in Hickory, and then we have a daughter who's about to graduate from UNC Charlotte this May. So she's essentially out. I don't think Anna will move back either. Our next one in line's a son, Luke, is a freshman at UNC Charlotte. So
Okay.
he's still home. He'll be home for summers and that kind of thing. And then 3 still living at home. Yeah, Evan is a junior in high school. And then we've got twins. Alex and Ryan are in 8th grade.
Okay. West Junior High or?
Hickory Christian Academy.
Oh, Hickory. Okay,
yeah,
gotcha.
When our kids were starting school, Alexander County didn't have any Christian schools yet.
Okay.
So,
but now they
do.
yeah.
Now I think there's several.
Okay. Very cool.
But so we're cheering on the sidelines of soccer fields and flag football fields quite often.
Yep.
Yeah.
We're in the throes of t-ball right now, and I was a soccer coach last year.
Thank you for doing that as a parent. That's being a coach.
It's a labor of love.
That's right. Yeah.
It's difficult, and I love it too. And it is challenging, especially at that age. And as they get older, I know it gets easier. But yeah, it's still fun. I love seeing them grow.
Some of the coaches, when the parents get kind of in there, but I'm just saying thank you for volunteering your time.
Yeah, I know exactly what you're talking about. Yeah, and it was my understanding you had an anniversary come up.
Yes,
for you too. 16 or what?
6
years of Bethlehem Direct Care. Yeah, our anniversary was March 18th.
Okay.
So we're in our 7th year of practice. We're in 27 years of marriage.
Right.
But yeah.
Okay.
7 years for the business.
Okay. Very cool. Yeah. Well, I think I have one more question, and my laptop came off here. Let me see if I can get it back on, because I don't remember what the question was. Oh yeah. Okay. So when you're not busy at the practice, I know you kind of alluded like sports and stuff like that, but is there anything else like that you two enjoy doing, like when you have some free time? I know you guys practice and you're business owners, so that free time may be limited, especially with the children and everything else. But is there anything in general like that you guys enjoy doing outside of all that?
Walk around the neighborhood.
That's right. That's what
Yeah.
we've been enjoying with the nice weather recently.
Yeah.
Yeah, I think we carved out a little time to watch a movie, just
We
interest
enjoy
of our
movies.
interest, not our kids, kind of stuff. And
Yeah.
although they may watch too, but yeah, those are nice, quiet times where you can do stuff, I think. And yeah, we're very thankful for the life we have and the practice we have. So,
Yeah, very much appreciative of the community for supporting us.
Yeah, and I'm honored and so glad that you guys came on today and to talk a little and share us a little bit about like your practice and let everybody know that weren't aware of that, because I certainly wasn't, and I hope more people are now after this video comes out. So
yeah, and we appreciate you focusing on Bethlehem.
yeah,
Yes.
yeah, very good. Well, that goes to say, if whoever's watching a local business wants to come on and talk, I'd love to have you on, and you can tell us about your business, and I can help promote you. So, yeah. Well, there you have it. It's been a pleasure. I've really enjoyed having you on.
Yeah.
Thank you
Thanks
for
for
having
having
us.
us.
Yeah.
Yep. All right. Thanks, y'all.